Usually when we talk about a medical diagnosis, there's this expectation of just absolute precision.
Right, yeah.
It feels almost like engineering,
Yeah.
Like you break your arm, the x-ray shows that jagged white line, and the doctor just points at the film and says, there it is.
Yeah, broken or not broken.
Exactly. It's clean, it's binary, and it's contained.
Well, I mean, it's a comforting illusion, really, because the deeper you go into human biology, the less binary things actually become.
Which brings us to our deep dive into the source material today. Welcome, and we are just thrilled you're joining us for this one. We're stepping into the wild world of computational pathology. And in this world, that clean X-ray machine analogy completely shatters.
Well, absolutely shatters.
We're looking at a diagnostic landscape that is incredibly murky. So our mission today is to really unpack a highly detailed 2025 technical report from Nature Cancer. And it introduces this breakthrough computational framework called SMMILe.
Right. And the problem that SMMILe is trying to solve is, arguably the biggest bottleneck in pathology today. We're talking about whole slide images or WSIs.
Okay, right. And to really grasp the scale of a whole slide image, I want you, the listener, to imagine trying to find Waldo.
Classic Waldo.
But, you aren't looking in a regular picture book. Imagine trying to find Waldo in a gigapixel-sized image of an entire sprawling living city.
Yeah, billions of pixels.
Right. Current AI can look at that giant image and easily tell you, yes, Waldo is definitely somewhere in this city. And that is basically WSI classification.
Yeah, but if you ask that same AI to act as a cartographer to draw a meticulous street-by-street map of exactly where Waldo and, all his friends are located, it completely fails.
Just can't do it.
No. That process is called spatial quantification. And right now, the only way an AI learns to draw that map is if a human expert spends millions of hours painstakingly drawing these tiny, expensive manual boundaries on training images first.
Which is, completely unsustainable. And this is the proposition of SMMILe. It stands for superpatch-based measurable multiple instance learning.
Quite a mouthful.
It really is. But it's a framework that not only delivers the overall diagnosis, but it acts as that master cartographer. It creates this incredibly precise, localized map of the tissue phenotypes.
And it does it without needing those manual human maps to learn from.
Yeah, it essentially teaches itself how to draw the property lines.
Exactly. So to understand how it pulls off this cartography trick, we have to look at how AI currently processes these massive images. Because like I said, a single WSI can contain billions of pixels.
Right.
You can't just feed the whole thing into a standard neural network. The computer's memory would instantly crash.
This is too much data.
Way too much. So researchers rely on a mathematical paradigm called multiple instance learning, or MIL.
I always like to think of multiple instance learning like a massive college group project.
That's a great way to put it.
Yeah, imagine the entire gigapixel slide is the bag. That's the final group project submitted to the professor. But because the image is too big, we chop it up into thousands of smaller, digestible patches.
The instances.
Right, those patches are the instances, the individual students in the group. If the final project gets a failing grade, which represents a cancer diagnosis, the AI knows that someone in the group messed up.
But the individual students don't have grades attached to them.
Exactly.
The individual patches are completely unlabeled. So the AI has to figure out which specific instances are responsible for that failing bag label. And historically, the mathematical theorems behind MIL have split into two, fiercely debated approaches to solve this, RAMIL and IMIL.
Let's unpack the first one, RAMIL, or representation-based ML. What exactly is going on there?
Right. So in RAMIL, the model aggregates its data at what we call the logit level.
Wait, logit level. Can we break that down?
Sure. Without getting too bogged down in the heavy math, a logit is essentially the raw, unnormalized prediction score before it's turned into a probability. So RAMIL calculates a representation for every patch, but then it uses an attention mechanism to look at the whole group's vibe before making a final prediction on the bag.
So it's judging the group project as a whole, rather than interrogating the students one by one. I imagine that makes it pretty good at guessing the final grade.
Oh, it is fantastic at predicting the overall slide label. But because it relies entirely on that broad slide level label, its attention scores aren't directly tied to the individual patches.
Oh, I see.
Yeah, so it gets easily misled by confounding factors in the tissue. It overfits to completely irrelevant areas. So you get the correct diagnosis, but your map is practically useless.
Which brings us to the rival approach, right?
Yeah.
YAML, or instance-based MIL. I'm guessing this one actually interrogates the students individually.
Exactly right. The model calculates prediction scores for each individual instance first before it aggregates them to grade the bag. And mathematically, tying the score directly to the patch makes it vastly superior for localization.
But the Nature Cancer report details a specific theorem proving a fatal flaw in IML, doesn't it?
It does. Because IONS is so intensely focused on finding the defining feature of the bad, it produces these highly skewed attention maps.
Skewed how?
Well, it gets completely obsessed with the most obvious, highly discriminative cancer cells. It assigns them massive attention scores and practically ignores the subtle, low discriminative cancer cells.
Ah, so in data terms, it suffers from incredibly low recall.
Yes.
It finds the absolute brightest, most obvious Waldo-wearing neon, but it completely misses all the other Waldos hiding in the shadows.
That is the perfect way to visualize it. RAML gets the big picture but loses the map entirely. IML finds the obvious spots but goes totally blind to the subtleties.
Okay, so if we gather our bearings for a second, this is the core puzzle of computational pathology. We have images too massive to process at once, so we break them into bags and instances.
Right.
But our two best methods for analyzing them either blur the map or only highlight the loudest data points. Which means, as a quick recap for you listening, WSIs are huge, MAML breaks them up, RAML gets the vibe but no map, and IML finds the neon Waldo but misses the rest.
Spot on.
It really makes you wonder, if you were building an AI from the ground up, how would you force it to actually look at the whole picture, shadows and all, instead of just taking the path of least resistance?
And that exact question is what the architects of SMMILe set out to answer. They engineered a framework with 5 highly specific modules that, frankly, force the AI to become a meticulous cartographer.
Let's walk through how this actually works in practice, because the engineering here is just fascinating. For memory, I like to visualize a literal smile slowly spreading across a massive slide, making sure it touches every corner.
I like that.
So step 1 makes sense. Slide preprocessing. The gigapixel image is simply too big.
Right. So first, SMMILe uses neural image compression, NIC, leveraging a pre-trained encoder to extract features and compress the WSI. But it doesn't just overlay an arbitrary grid. It tessellates the image into what they call superpatches using an algorithm known as SLIC.
Wait, what makes a super patch different from just, a regular square patch?
That's a key detail. A superpatch groups pixels based on their actual biological similarities, not just geometric lines.
Oh, wow.
Yeah, it creates organic neighborhoods. Then SMMILe applies a convolutional layer over these neighborhoods.
Expanding the local receptive field.
Exactly.
Because without that convolution, the AI is essentially staring at a single house through a telescope. It has no idea if the house is in a suburb or an industrial zone. By adding that layer, the AI can see the entire neighborhood, giving it crucial biological context.
Which is absolutely necessary for the next module. And this is arguably the most counterintuitive part of the whole framework parameter-free instance dropout.
Wait, hold on. You're telling me it intentionally drops data?
It does.
The report says it stochastically removes the highest scoring instances during training. Why would an AI voluntarily put on a blindfold during a test? I mean, we want it to find cancer.
I know, it sounds totally backwards until you remember IML's fatal flaw.
The neon Waldo.
Right. IML obsesses over the easy, obvious cancer cells and just stops looking. By actively identifying and then dropping the most obvious, highest-scoring instances during training, SMMILe essentially puts a blindfold over the easiest answer.
That is genuinely brilliant. It's like confiscating a student's cheat sheet.
Yes.
You're forcing the system to say, okay, the neon Waldo is gone. I have to look harder at these shadowy, subtle cells to figure out why this image is still labeled as cancer.
Yes.
It actively trains the AI to recognize low discriminative features.
Yes, and it pairs that with delocalized instance sampling. From those organic superpatch neighborhoods we created, the system randomly picks just one patch to create multiple subbags, repeating this over and over.
So it's constantly shuffling the group project, making sure the model sees a highly diverse crowd of instances in every single training iteration.
It acts as a massive data augmentation step at the slide level, drastically improving the model's robustness. But, you don't just train an AI on cancer, you have to train it on healthy tissue too, which is where the consistency constraint comes in.
Right. This is applied only to the negative bags, the slides with no tumor. Because if there's no cancer, the model shouldn't be fixating its attention anywhere.
Exactly. The framework uses a mean-squared error loss function to force the model's attention to be completely uniform across the entire healthy slide.
Oh, I see.
It's teaching the AI the baseline. It learns exactly what boring, normal tissue looks like, which is the only way to drastically reduce false alarms or false positives later on.
Which brings us to the final piece of the architecture, and this is where it really sets the property lines. The MRF-based instance refinement. MRF stands for Markov Random Field.
Yeah, MRF sounds intimidating, but it's essentially a mathematical way to understand spatial relationships. SMMILe calculates two things here: unary energy and pairwise energy. Unary energy is the AI looking at a single patch and asking, based on my training, does this specific patch look like cancer?
But then it uses pairwise energy, which I like to call the peer pressure mechanic.
I love that analogy.
Yeah. The AI looks at the 8 patches surrounding that first patch and asks, do we all agree?
Exactly. If the AI is on the fence about a patch, but the pairwise energy reveals that all 8 surrounding neighbors are definitely cancer, the MRF constraint applies spatial smoothness. Peer pressure dictates that this middle patch is highly likely to be cancer too.
And it trains this via a self-training network using pseudo-labels, right?
Yes.
It takes the top percentage of its own highest confidence predictions and the bottom percentage of its most confident negative predictions and uses them as a temporary answer key to teach its own next layer. This allows SMMILe to set a unified decision boundary across entirely different patients, smoothing out the map.
Right. So when you combine all 5 of these modules, the neighborhood context, the blindfold forcing it to look harder, the diverse sampling, the healthy baseline, and the spatial peer pressure, you get a framework that doesn't just predict a label, it deeply understands the geography of the tissue.
It's a profound paradigm shift when you really think about it. When we spend so much time in technology trying to feed AI the cleanest, most obvious data possible, but this framework proves that sometimes intentionally taking away the easy answer, putting on that dropout blindfold, is the only way to force genuine, nuanced learning.
It really is.
So quick recap. Pre-processing shrinks and groups the image into superpatches. Dropout hides the obvious clues. Sampling mixes the data. Consistency learns the normal baseline. And MRF peer pressures the map into spatial smoothness.
Perfect summary.
It makes you wonder, for you listening, think about that dropout blindfold. How might intentionally hiding the most obvious answer help you solve a complex problem in your own life?
That's a great philosophical takeaway. But in the realm of computational pathology, beautiful philosophy doesn't matter if the math doesn't hold up in the clinic.
Right. We need evidence. Let's look at the ultimate test. The scale of the benchmarking in this Nature Cancer report is just staggering. They didn't just test this on one easy tumor type. They threw 8 distinct data sets at it across 6 diverse cancers.
Yeah. Breast, lung, renal, ovarian, gastric, and prostate.
We're talking about 3,850 whole slide images.
And they tested it across 3 escalating difficulty levels. Binary classification, simply, is there a tumor or not? Multi-class classification, which specific subtype of cancer is this? And the notoriously difficult multi-label classification.
Multi-label is where you get into mixed tumor heterogeneity. This is where a single slide, a single patient's tissue, contains multiple different types of tumor phenotypes all mashed together in a mosaic.
It's chaotic.
It's an incredibly complex map to draw. To test SMMILe against 9 of the current state-of-the-art models, the researchers used 2 different AI lenses or encoders to process the raw image data.
First, they used ResNet-50. This is an ImageNet pre-trained model. Think of it as a brilliant generalist doctor. It knows what a car looks like, what a dog looks like, and it can figure out tissue textures pretty well.
And with that generalist lens, the impact of SMMILe's framework is immediately obvious. In overall slide classification, measured by area under the curve, SMMILe beat the second-best methods by 2 to 11%. But in spatial quantification, actually drawing the map, it absolutely crushed the competition.
It wasn't even close.
On the breast and gastric datasets, SMMILe outperformed the others by over 20% in spatial F1 scores.
And, F1 score is a crucial metric here. It's not just about raw accuracy. It's a harmonic mean that balances precision, not making false alarms, with recall, not missing the hidden cancers.
Right.
A high F1 score means you are drawing the boundaries exactly right.
But let me play devil's advocate here for a second.
Go for it.
ResNet-50 is a generalist. What happens when we equip all these competing AI models with the ultimate specialist lens? The researchers also tested them using Conch, a pathology-specific foundation model trained on over 1 million microscopic image caption pairs. Doesn't a rising tide lift all boats? If you give a struggling model a super smart lens, shouldn't it catch up to SMMILe?
You would definitely think so. And to be fair, with Conch, almost all the models improve their overall slide prediction. Most jump to near 100% accuracy in just shouting, "Yes, Waldo is in the city." But, and this is the defining revelation of the paper, They still fail at the cartography.
Even with the best foundation model in the world.
Even with Conch, SMMILe still outperforms the top 4 competing models by 5 to 20% in spatial F1 scores.
Wow. Why is that?
Because the other models still struggle with recall. The foundation model makes them very precise. They don't flag healthy tissue as cancer anymore, but they still suffer from misdetections. They still can't set that unified decision boundary across the subtle margins of a tumor. SMMILe's MRF peer pressure module captures the subtle margins that the others, despite their great lenses, completely miss.
So the framework itself matters just as much, if not more, than the foundation model.
Exactly.
There was one tiny exception in the data, though, regarding the breast and ovarian datasets.
Oh, yes. In those specific datasets, the actual tumor regions are incredibly tiny compared to the whole slide. Mathematically, the penalty for a misdetection is lower there. So a competing method called SMMILe scored competitively on overall prediction. But even then, SMMILe still beat it by over 23% in that spatial F1 score. It always draws the better map.
Okay, so to recap segment 3, they tested on 8 datasets and 3 difficulty levels using a generalist and a specialist lens. And SMMILe just crushes the competition in spatial F1 scores because it actually draws the boundary lines correctly.
Yeah.
Which brings up a question for you listening. Does giving a broken map maker a better telescope actually help them draw a better map? SMMILe proves the framework matters just as much as the foundation model.
Right.
But we have an AI that consistently beats other state-of-the-art models in drawing boundaries.
Right.
That raises a really uncomfortable question. The AI is being graded against the ground truth, the manual boundary maps drawn by expert human pathologists.
Yeah.
What happens when the human and the machine disagree?
Well, the researchers wanted to know exactly that. They isolated what they called contentious patches. These were microscopic areas where SMMILe strongly disagreed with the human annotator and where all the other AI models had failed.
Literal showdown.
Exactly. They essentially set up a showdown, bringing these specific patches to a senior expert pathologist to adjudicate who is right, the original human or SMMILe.
Let's look at the lung cancer case first. It's like a microscopic detective story.
It really is. In the lung dataset, these contentious patches were sitting right on the tumor margins, the absolute frontier between healthy tissue and cancer. The original human annotator hadn't colored them in. They thought it was safe, but SMMILe flagged them as positive.
And the verdict?
When the senior expert reviewed them under extreme magnification, they confirmed SMMILe was right.
Wow.
The patches contain highly suspicious, undifferentiated tumor cells hiding deep in the stroma. The human eye had simply glossed over them due to visual fatigue.
The machine caught what the human missed. And it wasn't just finding hidden cancer, it was categorizing it better too, right? Look in the gastric cancer case.
Exactly. This was a subtyping disagreement. SMMILe classified a specific patch as a mucinous tumor subtype, but the human ground truth had explicitly labeled it highly differentiated, which is a distinct, separate category.
So what happened upon expert review?
It turned out that patch was sitting in a transitional zone between 2 tumor areas. It was a biological gray area, but under intense scrutiny, it clearly displayed a mucinous pattern. Once again, SMMILe's map is more accurate than the original human label.
It's a profound validation of the architecture. I mean, a mathematical, instance-refined approach, one that forces itself to look at subtle clues and relies on spatial peer pressure, can actually surpass the limitations of human visual fatigue when evaluating billions of pixels.
It's incredible.
It really bends the mind. So to recap, case studies in lung and gastric cancers showed SMMILe correctly identifying tumor margins and subtypes that were poorly annotated by humans. Which makes me ask you, the listener, how do we grade an AI's performance when the human answer key itself is blurry? We are building systems that are becoming more precise than the cartographers who taught them.
And if we look at the broader implications of this, this isn't just about saving a pathologist some time at a microscope. It's about opening up entirely new avenues of quantitative analysis. Because SMMILe perfectly maps tissue phenotypes without needing human hand-holding, researchers can now conduct massive, automated retrospective studies.
They can feed thousands of historical patient slides into the system, perfectly map the mixed tumor heterogeneity, and analyze how the exact proportion of different tumor subtypes in a single patient correlates with their survival rate or their response to a specific drug.
Precisely. It turns a qualitative human judgment into a highly structured, measurable data pipeline. That leads directly to better prognostic evaluations and highly targeted genomic therapies.
Which leaves me with a final, lingering thought from the conclusion of this research. We've established that SMMILe doesn't need humans to explicitly draw the maps to learn how to find these boundaries. it learns the spatial relationships on its own,
Right.
which means it has the potential to discover entirely unknown pathological phenotypes. If this cartographer is mapping relationships and biological patterns that we humans don't even have words for yet, could it end up teaching us an entirely new biological language?
It's definitely possible.
Keep that in mind the next time you hear someone say AI is just a stochastic parrot copying human data. Sometimes it's seeing a map we haven't even dreamed of yet. Thank you for joining us on this deep dive into the source material. Stay curious, and we'll see you next time.